So Med 109, Medical Common Records. So Chapter 5, Therapeutic Communication Skills. So just look over the learning outcomes, and I'm going to go over some of the terms that are listed here. Right? So active listening, right? Pretty easy. Paraphrase what the person says and give it back to them just to check for accuracy. Bias, well, you're slanted towards one or the other, so you're favoring one group or another. That's bias. Body language, of course, part of communication. Most communication is nonverbal, and a lot of it is body language. Closed questions, easy. Answer with yes or no. There are some times where that's appropriately used. Clustering, so nonverbal stuff. You kind of describe it verbally, what they're trying to say. Right? So if someone says this, does this, right? Is that good or bad? Bad, yeah. So just verbalize. So you mean that was bad? If they gesture something. Compensation. So we know this, right? Somebody drives that sports car. We always say they're compensating for something. Or if it's a little tiny short guy, he drives a big gigantic truck, right? So you're using something else to make up for a shortcoming. Congruency. So your body language and what you say matches. That's what they mean by congruency. So if you tell your kid, you're going to get in trouble when we get home, right? You're sending them mixed signals if you give them a thumbs up and a smile at the same time. Cultural brokering. So that means you're the interpreter. And not only language, but also customs, beliefs, and attitudes. So not just only language, but cultural exchange as well. So you're the in-between. Culture, so a group's beliefs, attitudes, desires, wants within a particular area. Decoding, so when you send the message, you send it in code. And when you receive the message, you have to decode the message. Defense mechanism. Things you do to prevent you from getting hurt. Right? Some people build walls. Right? Some people build ditches. So we'll talk about the different defense mechanisms, such as regression. We'll talk about that. An example of a defense mechanism is denial. Right? If you're in denial, you're not facing the problem. In this case, for patients, their disease. Displacement. You put emphasis on something else that's not even part of it. And I'll give you guys an example when we get into lecture. Encoding. So when you send a message, you encode it with your choice of words, tone, expression, body language. And then when the person receives it, they decode it. So just the opposite. Hierarchy of needs, they're referring to Maslow's. We'll cover it a little bit more today. High context, meaning you got to understand and read between the lines. So a lot of cultural references. So if I talk about American movies all the time and you're not from America, you wouldn't understand it, right? So that's what they mean by high context. You got to know the lingo, know the culture. Indirect statements. So unlike yes or no, direct statements, here it's open-ended. It allows the patient to express themselves and you as the provider to explore. Interview techniques. So we want therapeutic. So we never want to probe. The question why is never appropriate. We never ask why. Kinesthetics or kinesia. So you can study how the body moves. That's a whole science in itself. Low context. Now you don't have to read between the line. It's direct. Anybody from any culture, background, age group would understand your choice of words in the communication. Masking, just covering it up. Open-ended questions, just like your indirect statements. Before or after? So here you have judgment about a group or a person before. Right? So that's prejudice. You have a problem in projection, but you give it to somebody else. You're shy, so you say, oh, my kid doesn't want to go because they're shy. But really, you don't want to go to the party because you're shy. So you project it onto them. Rationalization, you make sense of things. Usually it's not very rational, just so you buy it yourself, right? Justification. Regression, going backwards in behavior. Usually kids, right? Sucking thumb sometime, that's regression behavior. Why do kids suck their thumb? It comforts them. How are you supposed to deal with anxiety? You're supposed to talk it out when you're 3, 4, 5. But if you go back to sucking your thumb for comfort, that is form of regression. I'll talk about a few more examples. Amnesia. Something happened so crazy, so bad, traumatic. Oh, I don't know what happened. They have that traumatic amnesia. So that's a type of regression. Roadblocks, noise, obstacles, anything that is in the way of communication. Anything that prevents the message from being conveyed. That's a roadblock. Sublimation. So something that's usually bad, you turn it into a positive. So if you got a little teenage boy that has a lot of aggression, put him into sports. Now he can beat the hell out of baseball all he wants with a bat, nonetheless, right? So now it's a positive thing. He's not hurting other people, not punching them. He's hitting the baseball, right? Therapeutic communication, we'll talk. That's the whole chapter. Time focus. So some people relate in the now only, and then some people think in the future and long term, right? Depending on their needs or lack of resources, right? Will determine if they can only think about what's happening now or the future. So let's say I'm homeless. I got to think about when's my next meal. So I can't think about tomorrow or a week from now. I have to focus on tonight if I'm eating or if I have a home. Not too bad. Let's go to the lecture. I'll give you guys a moment to get to the lecture. Therapeutic communication skills, chapter 5. So empathy versus apathy versus sympathy. So A is without, so you don't want to show apathy. That's no feelings at all. You don't want to show sympathy because that's feeling sorry for the patient. But you do want to show empathy, which is understanding. I may not be going through your stuff, but at least I can relate to it. Right? So very important, communication. Use non-technical language. You know medical terminology. You know procedures, but patients may not. So you're going to have to use common everyday language without losing the meaning. So that's the technical accuracy. So use simple language, but still must be correct. All right, let's talk about the communication cycle. So we got the sender, and with their message, they need to encode it. All right? That's your choice of words, your tone, your inflection, your pitch, the speed, everything. That's the encoding part. So you send the message. It could be verbal, electronic, body. And then when the person receives it, they need to decode the message. Do I understand your language? Do the words I use and the words you use mean the same thing? Right? So you got to consider those things when you're decoding and encoding the message, especially for patients who are of different cultural and language backgrounds. And then feedback, or the response sent from the receiver back to the sender. And then it's just repeat. So here it is in a diagram. So the sender encodes the message, right, sends it to the receiver decodes it, and then some feedback. So if you're actively listening, nodding the head, that's feedback enough. Saying yes, or go on, continue, things like that. We'll let them know. So encodes the message, and then the message must be understood. So for pharmacy directions, we never want to use the directions take once a day. Because if you're a Spanish speaker, what does once mean? O-N-C-E. Once. How much is that? That's 11, right? So do I take 1 or do I take 11? So make sure you know what words you should use or not use depending on the culture of your patients and clients. So 4 modes of communication. Verbal, that's just speaking. Listening, right? You gotta listen. That's the main part of communication. Body language, 70% of communication is body language. What you say and how you say it is the other 30. And then written. Nowadays, we use pictures, right, to communicate. So your emojis are now part of the writing. We're just like the Egyptian hieroglyphs these days. It's up to interpretation. So if you send somebody emojis or use these shorthand text, doesn't mean the same thing with your circle of friends. So the receiver must decode it. So what does LOL stand for? Laugh out loud, right? So everyone knows that. But some people might think it's something else. And then the feedback, sending the message back. Third ear. So your third ear is just your feedback, nodding, repeating, summarizing what the message is. So that's your third ear. So reinstate. So you want to mirror what the patient says just to make sure it's accurate. So a lot of times it's to verify. So verbal communication is when things are, of course, spoken. How many of you guys understand Spanish very well in this class? Enough to work in the office? So you'll be very valuable, especially in this area, because many of your patients may be of Spanish-speaking origin or Spanish-speaking only. The 5 C's, complete. Everything's there. Clear, right? Make it easy. Concise is simple, short and sweet. Cohesiveness, you don't jump around with the message. Everything connects together. And then lastly, always be courteous. So the 5 C's in all your communications. So communication will develop good rapport. First thing you should do is introduce yourself anytime you enter the room, and then address the patient by their full name, Mr. or Mrs. Smith. And then encourage the patient to talk. We'll talk about the therapeutic communication skills. And one of them is just to stay silent. So when you just stay silent, it gives them time to gather their thoughts. Informed consent. What's informed consent? When do you have to get informed consent? Who gets informed consent? The doctor, the nurse, or the MA? Who gets the informed consent for, let's say, a procedure or a vaccine? No, who's doing the procedure? The doctor. The doctor has to do the consent. But the MA can do the second witness, right? So make sure you're there doing the witness of the informed consent. But if they have questions, you might have to explain it to them in their language or language that's technically appropriate for them. Can you guys read body language? Yeah, sorta. You guys go out anywhere? No. You guys do any socializing? Corporate parties? Children party? Right. So if you can pick up on certain body language, then you know who wants to be approached, who doesn't want to be approached, right? If you're your arms crossed. So you'll probably see people who have their hands in their pocket, right? Do they seem trustworthy if they got their hands in their pocket? No, right? So certain posture, body language will convey a lot of things. So if a patient has kind of this body language, you ask them, "Are you okay?" And they go, "Yeah, I'm okay." Right? You're gonna have to read in it. That's an obvious case. So children, they learn body language first. Infants are able to recognize facial expressions and they can understand it. If you go and look up some videos, there's videos of parents who are expressionless with their infants, and their infants can pick up that there's something wrong. Because normally the mother's like, "Hey, how are you doing?" Laughing, smiling, making googly faces. But here they did a little experiment. The parents just straight face and would just interact with the kid, and the kid would just panic. So they're able to recognize body language, facial expressions way quicker than any verbal cues. So that primary caregiver, that infant situation I talked about in discussion, is very important. We want to keep that trust and mistrust, build that trust with the infants. When they're 1 or 2, that's going to be guilt. So they want to try stuff, but if they fail, they feel guilty. So as long as you know what stage your kids are in, you'll be able to better communicate. Emotions, yeah, 70% of language is nonverbal. So enunciate, what's enunciate versus pronunciate? What's the difference? Enunciation, pronunciation.
You're going off of say the words and the syllables, but you're almost pronouncing each one of the words and syllables. And, all the letters and the syllables.
They're kind of similar, right? Pronunciation, enunciation. So enunciation is don't mumble. That's all it is. Pronunciation is, did you say it correctly? Is it documentary or documentary? Which one is it? Is it documentary or documentary?
You watch a documentary.
But you're a documentary, right? So you got to use the correct accent on the correct syllable. So don't get bogged down. Just know that 70% will be nonverbal. How you say it, your facial expression, the tone, the pitch. Eyes, humans, very rare that animals show the whites of their eyes. So we can actually communicate and show our intentions with our eyes, right? So monkeys, you can't see the whites of their eyes. Other animals, do you see the whites? Not a lot. So we use definite for it. Some cultures, if you look somebody in the eye, what does that mean?
You're trying to kill them.
Yeah, you're calling them out. You're acting aggressive towards them. Wild animals, should you stare them in the eyes? Like a wild baboon and all those wild animals? No, because that's how they show dominance. They stare each other down. If you don't look away, then you're challenging their dominance. So in some cultures, no, you're not supposed to. Other cultures, yeah, if you're not nose to nose with them, then you don't have their attention. And they feel that, hey, you're not talking to me. Why are you moving away 6 inches? You have to talk to me like this, 1 inch away. So what culture is that? They like to be like nose to nose when they talk. So just be familiar and adjust your communication techniques accordingly. Personal space. So touch, and within like a foot, right? That's like your immediate personal space. Talking distance, when you're talking to somebody, how many feet?
Arms length, 5 feet.
Yeah, 5 to 10 feet talking, right? So different function require different personal space. Different cultures, they don't touch each other. Name me a culture where they actually have to give change in a little basket because they don't even want to put change in each other's hand. Japan. Remember?
Wasn't
if you pay, you put your money and change in a little basket. The clerk takes the money, gets the change, put the change back in the basket, and instead of touching your hand, putting the change into your hand, you take it out from the little basket because they respect each other's personal space. However, if you're on the subway, they're squeezing each other in. Have you seen that? Where they have actual professional people push in train cars. So it's kind of weird. You don't want to touch my change, but then you sardine against me on the subway. So different cultural, different practices in different areas. Posture. So everyone here has tablet neck. Have you looked in the mirror lately? Do you have the crease? That is the new fad. Everyone is like this all day long, in the car, in class, in bed, on the couch, on the sofa. So you get that line right here. That's the next new surgery that's going to pop up. So make sure you invest. So shoulders back. And of course, sitting is the new smoking. So did you see Sydney's desk yet? So go by at break time. Go by, check out Sydney's desk. You'll see that she has like a stand-up workstation to prevent that fatigue. Position your body. So here in the picture, this is a good therapeutic position. Showing patient, giving them your attention, but you're not crowding them too much, right? Talk with your hands for emphasis. There are certain cultures, right, notorious for talking with their hands. So touch is usually not acceptable because it's nonverbal, and anything that is nonverbal can be misconstrued, right? Misinterpreted. So, can you touch your patient? Can you give them a hug? Pat on the back? Give them a kiss? What can you do? Can a patient kiss you? Maybe you're in the pediatric ward and there's this little toddler, they run up, they want to grab you, hug you. Is that therapeutic communication? No, right? So you got to draw that boundary. But there's some touch you can do. Touch on the back of the hand, the forearm, pat on the shoulder, right? Some of those things. But if you're going to give a little kid a hug, just let them know why you give them a hug so they don't misconstrue it. So just be careful. So that's why I said express your intentions with your physical behavior. So I'm giving you a hug because I'm proud you didn't cry after I gave you 60 million shots. Right? That way they know I'm not hugging you because I like you, right? So that can get you in trouble. So mixed messages. Try not to get them mixed. Clustering, grouping nonverbal message into statements or conclusion. So like I said, hand gestures, patients tell you about, they might not say anything, but just make a statement, verbalize it. So you mean that was in the past, right? If they're doing a gesture like this over their shoulder. All right, masking is easy. That's just repression of your feelings. A lot of times it's to protect themselves. Kind of part of the coping mechanism. Men, do you know how to communicate with women? Do you understand women? Women, do you know how to communicate with men? Do you understand men? No, okay. Of the genders, who uses direct communication more? Men or women? Men. That means women, why don't you just tell me what you mean? But they don't. They communicate how they feel, right? So even with just simple men and women, you got to understand their motivation, their perception. And what's their motivation in communication? Men, transfer information. Women, what is it? Decipher. Yeah, getting as much information as you can. Information is power, right? So not just only the sexes, but cultural, right? Where do they come from? Western societies, Asian societies, Eastern society, different religions. They all interpret things differently. very easily misinterpreted. So, age, very young. So how do the very young show you anxiety? Little toddler, 9 months old, 1-year-old.
You cry.
Yeah, that's when they have extreme anxiety. When they have mild anxiety, they focus on every moving person that enters the room. And if you get close, they get closer to mommy, right? So at 6 months, kids are okay. You can pass them around. But once they're at 9 months, then they'll start to know who's mommy, who's daddy, who's a stranger. At 1 year, the kids should already know who's a stranger, who's not. Economics, definitely. So if you're poor, guess what? There's things you have to worry about that if you are well off, you don't have to. And a lot of time that can affect your communication and your health. For example, diet. So if you're not eating a lot of expensive fresh fruits and vegetables, then you're not getting the nutrition. So education, life experiences. We talked about bias. So bias is you have a preconceived notion, usually bad against a group. Prejudice, before judgment. And then for verbal roadblocks, that's usually language barriers. If there's noise in the room, if your physiological needs aren't met, like it's too hot, too cold, too much light, or not enough light. All right, we'll talk about some defense mechanism before we go to break, and then we'll finish this up. So regression, going backwards to previous behavior. So I mentioned one, the thumb sucking, right? So if a kid is already 2 or 3, they're already past their sippy cup, then they shouldn't be using their pacifier anymore for comfort. If something happens, traumatic event, they see a scary movie, then they might go back to sucking their thumb, right? And that's okay. But they should stop because that messes up their teeth, right? Another one is if a 2-year-old has a new baby, right? They're perfectly potty trained, but now that they have a new baby, they're wetting their pants again so they can get some attention, right? So if it's for just a little bit of time and they get over it, that's okay, that's normal. But if it sticks, then it's really, really bad. Right? And you guys regress all the time. Ladies, you guys do it all the time, right? So you get a fight. So there's 3 stages to regression. There's protest, despair, and denial. Protest, despair, and denial. So ladies, when you get a fight with your man, what do? You get mad, right? Protest. And then you get a little sad. So you get your ice cream Haagen-Dazs out, your cake. Right? You guys know what's going on. And then when he calls back, I don't want to talk to him. You deny him because you don't want to get hurt by him again, right? So protest, despair, denial. Classic symptoms of regression. So it happened to you more than once, I guess. Now, ladies, you do it again. Well, it's your kids. You send your kid off to school, right? Their first day of school, what do? They cry. I don't want to go, I don't want to go, I don't want to go, right? So that's protests. And then when you leave, they're crying by themselves in the corner. Despair. But once they get around to it, they start playing with the kids again, right? But when you come to pick them up, does the little kid want to come back home? No. Deny. Because he doesn't want to be abandoned by you anymore. So he's not going to give you any love. So that is regression. Protest, despair, denial. All right, so denial. So the stages of death, right? The classical stages of death. One of the stages is denial. This cannot be happening to me. So that's so you protect yourself. Right? Repression, same thing. That amnesia case I talked about. Something traumatic happened. You don't want to relive it. You don't want to deal with it. So you forget about it. You don't think about it. Projection. So what was my previous example? The mother was shy, didn't want to go to the party, so they said the kid was shy. So projecting her personality on the kid, right? So we do that a lot of times. Let's see. I'll go to displacement. So you take it out, You take your like problems out on something that doesn't even have to do with it. So the classic example is at work. The boss gets mad or something from the CEO, takes it out on the father, the worker. Right? The father goes home, can't take it out on his boss, so takes it out on the wife. The wife can't take it out on the father, so takes it out on the kid. And then the kid kicks the dog, right? And the dog goes chase the cat. And everybody displaces their problem on the next victim, right? Compensation, so that's pretty easy. The short guy has that big, gigantic truck, or he acts super macho, right? Or if someone is poor, they always have that rich appearance, right? Kind of that compensating for their lack. Rationalization. Something happened, like, did you eat the chocolate, right? All those videos of kids with chocolate stained faces and like paint or whatever, they're always doing some problem, and parents always catch them with the camera and ask them, so what happened to all the chocolate? And the kid goes, I don't know, the cat took it, and you never guess what happened. So they just make sense of things. All right, let's go ahead and take a break. We'll come back and we'll finish this up. Cultural and religious diversity. So blockage to communication, yeah. So especially with the genders, certain religions, male can't be alone with females, females can't be alone with males. So that should be a common rule anyways. So make sure you keep that for those modest cultures and religious beliefs as well. Western medicine, other cultures don't accept it. So in Africa, they prefer traditional treatment, which includes some spiritual healing and voodoo. Have you guys heard of Santeria? So that's a blend of Christianity and voodoo. So they use certain rituals like voodoo, but they pray to the saints. So that's a blend of Christianity and voodoo. So where did that happen? The Caribbeans, where you had all the African brought their traditions, and the Christians on the ships brought their tradition. Now you have that blend of Santeria. Maslow's hierarchy. So who recalls? What's the theory of Maslow's hierarchy of motivation? Why are we motivated? Because of a lack of need, right? So there are different levels of our need until we ultimately reach self-actuation, all that we can be. So if all of our needs are taken care of and we're self-actuated, then of course that's going to help our communication. So basic physiological need. So when you're without it, then you can't really function. Next, your safety needs. So that includes your shelter and your job security, right? That's part of it. So not just only physical, but your psychological safety as well. We're all tribal, right? Next, we need to belong. We're part of this gang, we're part of this tribe, part of this group, right? And then once you have all those, then you want that prestige. Right? I'm part of this group, but am I the alpha, the beta, the omega, or the zeta? Which one are you? Are you the alpha female? No. Are you the beta male? Are you the omega? Or are you the zeta? Which ones are you in the group? So that's what you want. Some people really need that esteem, that recognition, that pat on the back in order to be all that they can be. So down here at the basic levels. So basically, Maslow says if you lack any of those, then you're going to act out. And most of the time, we move away from pain before we move towards pleasure. But if our needs are met, we can then move towards self-actuation. ESL patients. So I gave an example already with once. ONCE, once, is 11 in different languages. get familiar with the common Spanish phrases that you'll use in the medical office. Audio challenge. Who pays for the interpreter? The patient, the office, or the state? ADA, American Disabilities Act. So you're going to have to provide accommodations. Right? So it's adequate accommodations. So you'll need to pay for an interpreter, sign language, audio visual equipment if you need to, like the telephone system. So build that trust with the patient and show empathy, right? Understanding. You may not be in the same situation, but you know how they feel. What is sympathy?
Feeling sorry for the patient.
Yeah, S for sorry. And then what is apathy?
Not caring.
Yeah, A is without any emotion. Show respect. Be genuine. So don't just go through the motion. I know we all have a script. And sometimes when we go to the store and the clerk just gives us the same script, patient after patient. Thank you, come again. Thank you, come again, right? So try to vary it up and be genuine.
Welcome back. Thank you.
Yeah, welcome back. Thank you, come again. Welcome back. Thank you, come. Yeah, now it's that. So now they vary it, right? They say at the greeter, they always use different greeting now. Cultural brokering. So not only are you the interpreter for language, but also for customs, beliefs, and attitudes amongst people of different cultures. So you might have to reduce that conflict, right? You can communicate with women, and then you can communicate with men. They have an argument. Now you can be the mediator, right? So if you go into counseling, that's all they do. They just mediate. Men communicate this way, women communicate this way. Go into couples counseling, they just culturally broker the communication. That's all they do. So not just only language, but like I said, customs and rules. So don't be alarmed when they ask you to interpret. Word for word? No, just give them the meaning. It's going to be very hard to translate word for word. Do you guys know sign language at all? American Sign Language? So with American Sign Language, you're not saying every single word. You're just saying the main phrases and using your facial expression and other cues to translate. Same when you're doing from language to language, you're not saying everything verbatim. You guys ever heard of that phrase, lost in translation? Yeah, right. So a funny saying in English, you say it to somebody in a different language, it's not funny, right? Or you try to explain to them all those American euphemisms. People from other countries, they may not understand, right? Yeah, family members as well. Can you, as an MA, disseminate life-threatening diagnosis to the patient? Or poor diagnosis? As the MA, is that your scope of practice? No. So if they ask, then just let them know the doctor will call them, or hold on the line for the doctor. The only thing you're able to report on some lab results is just normal. If it's within spec, just let them say, yeah, it's fine. But if it isn't, you can't say, oh, this is bad or that's bad. You just have to say, make sure you make an appointment to come in. And then the doctor or nurse, they'll go ahead and give them the news. Interview techniques. Not interrogation techniques, interview techniques. But it's very similar. You want to make sure the patient feel comfortable, open, so they share. and we'll talk about some of the therapeutic techniques. So there is a time to use closed questions where you just answer yes or no. So there's a time and place for it. But to start, you don't want to use yes or no. You want to allow the patient to talk, so use the open-ended questions. Or, what would you like to talk about today? Where would you like to start? That way the patient can direct their own treatment. Pause, give silence, allows the patient to gather their thoughts and they don't feel rushed. One thing you need to do at the end is to re-summarize, because sometimes if your time's up, you don't want to just abruptly stop the session and then usher the patient out the office. Make sure you recap, so save some time at the end of the session. Point of care. So where is the service being conducted? Usually it's in the office, sometime home health at the patient's home. And then if you cannot, then refer them to community resources. Can you think of one community resource that you may not be equipped with? Suicide hotline, right? Gamblers Anonymous, Alcoholics Anonymous, social services, sometimes shelter, violence against women and children. So those things you might have to report anyways. Might as well refer them to community services as well.